In this segment, we're going to fit a sacroiliac belt. The most appropriate or most common application for a sacroiliac belt is that patient who has hypermobile sacroiliac joints, usually associated in the female population with a monthly cycle or with pregnancy in any stage of pregnancy. So what we'll do is take the measurements and then fit the device and go through a patient education process. So the necessary measurement that you need for fitting the device is a full hip measurement. To do that, I want to see the patient from the side. There we go. Because I want to measure on the fullest part of the buttocks, about like that. And I want that a very, very firm measurement. And so I'm going to really cinch down on it. And so I got a very firm hip measurement. But for medical documentation, we also want a waist measurement and some length measurements. So I'll just have the patient face me and I'll get a waist measurement at the natural waistline, put your arms to the side, there you go. The natural waistline is going to be above the iliac crest, the top of the hip bone, and below the rib cage, the costal flare. Yeah, if there's an issue finding that mark, just have the patient do a lateral bend, a natural crease will form there. So that's a natural waistline. So we get a gently snug waist measurement, and then while the patient's still here, we want an anterior length measurement. That'll be from the xiphoid process, or the top of the rib cage, to the bony prominence below the belly button, the symphysis pubis. So we'll get that measurement. The patient will point out her symphysis pubis, and we'll get that measurement and document it as part of our documentation. And then from the posterior, if I could turn you around, Kira. From the posterior, we want a measurement from the inferior angle of the scapula, the bottom of the wing bone. It will drop down 2 inches, come to center spine, and go to the distal margin of the sacrum, which correlates to the top of the crease of the buttocks. And so we have that measurement for our medical documentation. Again, the measurement you need to size the product is that full hip measurement. So you can go ahead and turn around. So now we have our measurements, we have them documented. We can get the product out. And this came off the core rack behind me here. By the way, you can do that rack for about $200 as opposed to having product hidden away in your closet. It might make sense where something there might draw a patient's interest. And so it kind of makes sense to have that out and available if you have an open wall in your facility. So on all core products, the label is always going to be to the up, so we teach the patient that, they know up from down. And then I'm going to fit it on her relatively loose, then she will fit it to get the actual therapeutic support. But I'll fit it on her fairly loose just to show her the process. If I can see you from the back, please, Kira. We want the bottom of the support right in the middle of the back, and the bottom of the support should be at the top of the crease of the buttocks or at the distal margin of the sacrum. So we'll then bring the support around to the side here, and if I can see it from the front, you'll notice the product has loops in it, so it's made to be very, very easy for the patient to handle. We pull these out to the side like this, and obviously I can't do that to her, she can do it to herself. But we want that right at the right height. The bottom of the support again should be right at the level of her symphysis pubis. And we'll add compressive support here. You'll notice there's plenty of overlap in the front here. That gives a real nice firm control for that lower abdominal area that we want to support. And now that that's on, and we've got it at the right height, now we can use the pull tabs, and I'll start here. These also have loops, so it makes it very easy for the patient to handle. And if you're fitting the patient, you want to stabilize the hip and then pull on the cinch straps. And do the other side, again, stabilize that hip and pull on the cinch straps for extra compressive support. And so all I've done is I'm teaching her the position here, the position in back, and the process on how to get it on. I'm not giving her any real support because she can, again, get much greater support than I can do to her. So now that we've got the device on, we'll instruct the patient how to check the fitting, make sure it's at the right height. So if you could have a seat for me here, Kira. The main landmark that we want to teach the patient to check is when they sit down, the bottom of the support should come right into the groin area, right to the groin area. If it's too low, it will jab into the groin and cause some discomfort. If it's too high, then there'll be a space here, but then if it's too high, it won't give her the support she needs. So that's how they check to make sure they have it at the right height. So go ahead and stand up. And now we'll teach the patient how to take it off, and then obviously we'll teach the patient how to put it back on. Before we do that, it's important, I think, to notice that the elastic on the binding here stretches even greater than the elastic in the support. And so in a lot of devices, most of them out there, in fact, the binding doesn't stretch as much as the support. So you get ridges here, top and bottom, and you can't get the support you need out of the actual support itself. So on this one, the binding actually stretches more, and so you get the support that you need out of the device. So with that, we'll teach the patient how to use the hand loops and peel this back, like so. Yep, and then touch it down so the Velcro isn't flopping around back there and getting tangled up with something. So you do that both sides, and that can be done one at a time. And then use the hand loop here, put your hand in there and just touch your thumb there and peel it off. And that helps with that coming off. You take it all the way off and teach the patient how to touch the Velcro down so it doesn't, again, get tangled on the bedside overnight or whatever. So they can actually put it down. Okay, now go ahead and put it back on. And it's so important to assist with patient compliance that they're really comfortable with this process of finding which is up, which is down, and how to put it on. So you just center that. Before you close that up, I'd like to show something. If I could turn you to the side here. There are little stays here on the side. There we go. Little stays here on the side. Those should be lined up to align roughly with the lateral part of or the outside part of the leg where the seam would be on trousers or slacks. And so as she's pulling this, we'll ask her to pull to the outside, like there, and then do the close crossover. Yep, beautiful. And you can see she has that on much more snugly than I put it on her because she's got a much better leverage from her arms. And we don't want that on your clothes. I don't want you angry at me. So let's get that aligned just a little bit better. Beautiful. That's great. You can tuck this one up a little bit. So those just overlap each other very nicely. Now we've got, you can see how much overlap we have here. So we've got that double layer for lower abdominal support, which is going to be beautiful for there. Then she can do the cinch straps at the same time. And again, pull those out and then simply touch them down. And she's now has some very good support to help stabilize the SI joints, prevent that hypermobility. Very often this will be very significant in pain reduction and helping them function at a higher level. And how does that feel?
Very good.
Feels good. Again, we can teach her how to sit and to check her to make sure it's at the right height. Then we would teach her the care of the device. How to make sure, how to launder it, make sure all the Velcro's touch down, and we'll get into that in another program. So, but she should be comfortable now taking this off, putting it back on, and her compliance should be very, very good in this device.